body itself. So that's the sternum anterior. Then lateral anterior, you have the ribs. Then posterior, you have the what vertebra? Thoracic vertebra. How many thoracic? 12. Okay? So you review them the vertebral column. Cervical, 7. Thoracic, 12. Lumbar, 5. Sacrum, 5. Fuse, 6. Okay? So the thoracic cage, in relation to the sternum anterior, lateral, you have the ribs, posterior is the thoracic vertebra. Okay? That is the bones of the thoracic cage. In between the bone, you have still muscles. You have muscles of the thoracic cage, no? So pectoral region, okay? Then inside, you have here the thoracic cavity. Then, you have the, is the part there, where is the thymus located?
Posterior to the sternum.
Mediastinum, no? What is mediastinum? Huh? So, the mediastinum is space in between the two pleural sac. No? When you talk about pleural sac, that is the one that closes the lungs. So, at the center would be the mediastinum. So, the mediastinum is still divided into two. Superior, inferior. Okay? Then the inferior is divided into anterior, middle, and posterior. Based on the pericardium. So behind the sternum, pericardium, that's anterior. In between the two pericardium, anterior, that's the middle. Behind the posterior pericardium is the posterior. So the thymus is in the anterior mediastinum. Okay. May mediastinum na. No? Superior. It is in the anterior mediastinum. Okay. So behind the sternum, in front of the pericardium. Okay, so this is now the sternum. So this is the bone. Then you have the costal cartilages. You have 12 costal cartilage. After that, you have the ribs. Because the ribs will not go directly to the sternum, it will go to the costal cartilage. Okay? That would be part of the later segment when we discuss the lungs. But at least you know the sternum because behind, okay, you have now the fatty or remnants of the thymus, no? Because thymus will atrophy maybe at puberty, no? Puberty, ba? So you have to discuss the functions of the thymus tomorrow from the developmental, ba? Huh? Developmental. And what its function will, no? Development of T cells, B cells, okay? Then, during adulthood, kung find na siya, what will replace the formation. Diba? Kaya primary production dyan siya. Okay? So, produce something in relation to the immune system. You know, the blood supply, venous drainage, then the nerve supply. Okay? What is the blood supply? Comes from. Ano yung discuss tomorrow, no? Okay? Your thyroid artery, internal thoracic artery, venous drainage, okay? So, thymus. So, at least you know, it's behind here, the sternum. Okay? So, you have to dissect it out of this one. So, that's why there, the specimen, practically, anak, this is sternum. So, it's tag behind is the thymus. Okay, that's the structure. You cannot tag the artery or the vein. Smaller than siya. Okay? So, what's behind the sternum is the thymus. Okay? That's why it's dissected out. So here, we show you now the heart. Additionally, this is the pericardium surrounding the heart. Okay? Pericardium. Anterior to that would be, this is also thymus. That is another specimen. I put it there so that you can see it because they came out, including the ribs here. No? So what you can see here is the pericardium. Here to that we have thymus. Okay. So later on, when you go to cardiovascular system, you can study the heart. So may system ng tayo. So, okay. Next would be the bone marrow, no? Pero it is now in the lecture na lang yun. Because the bone marrow is in the, inside the long bones, no? So you have either red marrow, yellow marrow, you have to differentiate marrow. Okay? What is produced there to show ko pa na siya later, what will be in the flat bones na. Okay? So that is in relation also. So we will produce also the leukocytes. So these are primary. So we have bone marrow and the thymus. So in here, specimen is the thymus. Okay. We have bones there, but I'm not sure. You can see that on the inside, that's the marrow. Lalok na rin. Okay, we'll go now to the secondary. Okay, so what is the secondary?
Spleen.
Spleen. Okay, so the spleen located where man? Spleen. Spleen. So it's in the, so ano nga sa, where? Thoracic cavity, abdominal cavity. So at least abdominal cavity. So abdominal cavity is a very big cavity, no? It's behind the upper part is the diaphragm. So diaphragm separates thoracic cavity from the abdominal. Then the abdominal cavity anteriorly you have muscles there also. External oblique, internal oblique, transversus abdominis, the center you have the rectus, peritoneum taken out. Okay? Now tuning mo na you can divide the abdomen as a right upper quadrant, left upper quadrant, left, right, lower quadrant. You can divide the abdomen into 4. That's why natin yung na left upper quadrant. Let's call it 4, no? Left upper quadrant. But when you go to digestive system, you can divide the abdomen into 9 more. Okay? So at your level, parang natas 9. Okay? Okay, simple naman itong right upper. Pero nag-100 organs. But if you specific pa yun, you can divide the abdomen into right hypochondria, yung epigastric, left hypochondria, the umbilicus, right lumbar, left lumbar, hypogastric, then right inguinal, left inguinal. So the spleen in particular is in the left hypochondria. Okay? More or less at the 9, 10 rib behind. It would be the ribs here. 9, 10, left. Okay? So if you open, that would be the location of the spleen. Okay? Liver, the spleen somewhere here. The kidney, inferior. Okay? The kidney is inferior. Anterior to that is the splenic flexure. What is the splenic flexure? What is part of the splenic flexure? Large colon. Yeah, large colon, di ba na ascending? Yeah. Curve. What is the flexure in the right? Right. Hepatic flexure. The transverse colon. Then you have another curve going down, descending. So the flexure there, near the splenic, that's why it is called splenic flexure. Pwede po na right colic flexure, left colic flexure. Pero because of its location near the spleen and the liver, it is called hepatic flexure, splenic flexure. This is the transverse colon. That, the angle there, going down, this is now the descending. That will be the hepatic flexure. So, anterior flexure. Okay? Then, superior part will be the stomach. So, the stomach is in the superior part. So, the stomach here, spleen below. Anterior is the hepatic splenic flexure. Below is the kidney. So that is the kidney. Left kidney, ha? So specify na left kidney. Okay, it is in the left, ha? So you discuss that one tomorrow. Location, relation. Next, the ligaments, touching. Okay, kung wala nagka-touch, so ambong na ka na. So na yung mga attachment sa mga organs. Okay? So what are the ligaments? So sa lecture na here, kailangan ito ano, mas tama. Okay? Gastrosplenic. So that's between the stomach and the spleen. Okay? Then, between the what? Kidney and the what? Spleen. Splenic. Okay? Then you have also the between the pancreas, okay? What we call colic, okay? Splenic. Ligaments, huh? So we discuss the ligaments. Renal, splenic, gastrosplenic. So the ligaments will attach the spleen to the posterior anterior, and you have blood vessels. Okay? You have 3 ligaments there. Huh? And what are the structures passing to that ligament? Next, as an organ, it has a blood supply, venous, no? So all the blood supply and the venous supply will enter the what part of the spleen? Any organ, just like lungs, there is one structure where the vein will end out, the artery will enter. That part is what you call the hilus. Okay? The pinag-solid organ, the kidney has a hilus. That is the part where the vessel will enter. No other part. So that's the hilus. The lungs, the high part. The hilus of the lung. Liver. Kidney. Okay? So the spleen, the part is facing medial. Okay? This one is the posterior, huh? Or the okay? So that part there where the vessels will enter is called the hilus. Okay? And you might wonder, what's something siya to start? What is this? Huh? Pancreas. Okay? So the pancreas will be discussed in the digestive. Okay? Is the spleen part of the digestive accessory organ? Digestion? Spleen. Okay, pancreas is accessory organ of the spleen. Ano siya function sa digestion? Wala ah. What do you know? It is part of the immune system, largest lymphoid organ. Huh? So, the tail of the pancreas, like if you divide the pancreas, you have the head, neck, body, and tail would extend up to the hilus, but it is not part of the hilus part of the structure that will enter the hilus. The tail of the pancreas located in the hilum, near the hilum. That's why this is the tail, and this is now the hilus. Huh? Okay? So, hilus. So that would be the normal location. It's taken out already. Huh? So usually that would be the body, the head, neck, the tail, the body, then the tail. So the tail of the pancreas extends to the hilus of the spleen. But it is not one of the structures that we enter. Huh? Okay? So the blood supply to the spleen. Okay? So what is taken out here, you cannot see already the pancreas. So this is the spleen in its normal location. Okay? This is the left lobe, right lobe of the liver. So the blood supply, okay, you have the splenic artery. The splenic artery comes from, so from now on, you must know the origin of the artery every time we discuss, so that you will know where it comes from. Huh? Not only memorize the blood supply, splenic artery, but if you ask where it comes from, na siya, diba, artery na, siya bitan. Okay? Veins, asya siya membrane. Okay? So, splenic artery comes from celiac trunk. You know what is celiac trunk? Celiac trunk. You have three branches of the celiac trunk. One of the biggest branch is the splenic artery. Second is the left gastric. The third is the hepatic artery. So you have three celiac. That would be one. The celiac trunk is the first branch of the abdominal aorta. So, di ba? Abdominal aorta. Aorta. Splenic artery, left gastric, going up, supplying the food with the blood. Okay? You will discuss the celiac trunk later when you go to digestive. Okay, blood supply na siya sa stomach, and it also goes blood supply to the liver. But we discuss it here because of the origin is the splenic. Okay? So discuss for tomorrow. You have drawings that you can see that in the drawing if you have studied it already. Explain it as a whole. Okay? Then venous drainage. So here, the artery is always thick, no? Hard. Compared to the vein, which is flat and collapsed. Okay? So the splenic artery is on top. Yeah, the splenic vein is below or behind. Artery, vein. Okay? So venous drainage, splenic vein. Where it goes, man? So after the spleen, it will go to where? Portal vein. It becomes portal vein when it joins what vein? Huh? Aortic. Superior mesenteric vein. So the superior mesenteric vein and the splenic vein will join together to become the portal vein. Then the portal vein will go to the liver. That is now the portal circulation. So the venous drainage of the superior mesenteric, inferior mesenteric of the intestine will go first to the liver. Then the liver will filtrate it. Then the liver has what you call hepatic veins. The hepatic veins will go to the inferior vena cava. The inferior vena cava now will go to the heart. So the portal vein will not go to the inferior vena cava. There's no connection. The portal vein will go first to the liver.
Okay.
Okay, now, what else? So tomorrow you discuss the function of the spleen, what is filtered there, okay? Diba? Aka na mga WBC o red blood cells. Kung may defects sa red blood cells, yung mga medtechnique, spherocytosis, wala siya biconvex na structure, so it will be filtered kay ang spleen. It thinks about the normal man. That's why yung function is abnormal. It will become big, no? What is the term? If you have enlarged spleen, splenomegaly. So there are diseases in the either in the hematopoietic system, no? If you have diseases, anemia or secol, it will become big, especially in children. So one thing, they will remove the spleen as part of the one, okay? Splenectomy. Okay? Naku ang liver, hepatomegaly. Spleen, splenomegaly. So we discuss that. So you discuss that one tomorrow. Okay. Spleen. Question? Next. What else? Secondary. Lymph nodes. What are lymph nodes, man? So they are like catch basin, man. No? So they are located in areas lang na where it will, no? Particular the head. Particular lymph nodes,
Auxiliary.
axilla, Okay? Supraclavicular, the mediastinum, or the big blood vessels na ano. Then you have the aortic nodes, inguinal lymph nodes, no? So they are filtering. Okay? But they still function with the immune system. They will maybe proliferate these cells, no? That's why if you have malignancy or infection, you have infection in the mouth, like abscess or one of your teeth na bacterial infection, ubag. You can see na also your lymph node will become inflamed. Okay? So meaning the bacteria infiltrate there, so it becomes attacked by the antibody, so it becomes inflamed also. Okay? Malignancy, that's one sign na it has already metastasized, no? Meaning the cancer cells invaded also the lymph nodes, so it also becomes big. No? Okay? So that's why lymph nodes are sometimes are signs ba na you have already metastasized. It will matter the stage of the disease, lymph nodes. So you have, so part of the lymph node system, you have lymphatic system, no? Sabi pag lymphatic system. What is lymphatic system? When you go to cardiovascular system, part na siya, ha? Kay naman kay arterial, na kay venous. How about the lymphatic? Muna siya yung mga fluids, no? Collected. But it will drain also back to the venous system, somewhere in the neck, to the subclavian. Okay? So you have two major lymphatic system. Huh? Okay? The thoracic duct and the right, okay? Thoracic system. Right lymphatic and the thoracic duct. Okay? Drain the head, right side, so reveal that. Okay? So that's the lymph that will be carried. That's why patients with abdominal cancer, sometimes you can palpate lymph nodes na here, no? Okay? Stomach, if you have uterus, it will sometimes manifest in the supraclavicular. But because of lymphatic system, it will be carried there, no? Okay? So that's why you have an idea, if positive ang lymph nodes axilla, you have chance na maybe the breast have cancer. Supraclavicular, your chest, maybe in the lungs, no? Ano ba? So it will tell you what part of the organs it is draining into because they are drainage. Okay? So you must discuss also the lymph node tomorrow. The afferent vessel, the cortex, medulla. And what will happen there, presentation, what will be activated there when asunod ang bacteria. Okay? Next. The appendix. Okay? So appendix is included because he said it has abundant of lymphoid tissue. But its function is, when you read some books, unknown, do you know? Unknown? Diba? No. But it is a lymphoid. But pero na siya function dyan. It's the function of the appendix. Para ang surgeon mabuhi, no? Because this is the most common surgical procedure. So, ma-inflame na, it's called appendicitis. Then one treatment job only is appendectomy. So ang surgeon ito, so this is now the appendix. So, this would be the transverse colon descending, okay? And this would be the transverse descending. So the appendix is located where? In the what part of the colon? Descending? Okay. What is the first part of the colon, man? before the ascending. Secum, tawag ba, no? Secum. Then, ascending, transverse, descending, sigmoid. Ha? So, napay secum. So, it is in the posterior medial part of the secum. Near the, what is the last segment of the small intestine?
Ilyum.
Near the ileocecal junction. Ano siya, appendix. Okay? So, ana ang location. This is the ileum. This is now the pouch, the secum. Then the ascending colon, transverse. So, this is now the appendix. Cute, no? Appendix. Okay. So, sometimes lagi, because yat sa lumen man, no? Appendix sa lumen. Sometimes, common kay Musudia is the fecalate. No? Then the fecalate will mabara, so the secretion will not go out. Idimatos siya. Then idimatos, the first that will be compromised is the venous. The mouth, it will idimatos. Then next would be the arterial. The arterial now, no more arterial supply, it will become what? If you have no arterial supply, what will come to the organ? Gangrene, no? No. And lastly, it will muna rupture. That's why, kailangan na lang. So that's one function. So, even though you have no more appendix, so that it is then emphasized for organ naman siya. But the function really, medyo na makorelate it. How many naman taot na appendectomy, pero it will not matter na. Okay? So that would be the appendix. So you must discuss the blood supply comes from the initial artery, comes from the ileocolite, comes from the superior mesenteric. And siya mesoappendix. Okay, touch. Okay. What else? So what you can identify here, lymph node, then appendix, the thymus, the spleen. Now, the ileum there is pagawas lang because you have there in the ileum the Peyer's patches. But we cannot tag the Peyer's patches. Okay? It was just open na. You will know na ileum. But you will study the ileum when you go to the gastrointestinal tract. You compare the ileum to jejunum, no? Okay? So in the ileum also, you have there what you call the lymph node by the Peyer's patches. That's why in cases of typhoid fever, that lymph node there will managko. It will also compromise the ileum, just like appendix pa, no? You have typhoid ileitis, it becomes edematous, then it will perforate also sometimes. Typhoid ileitis. Okay? The bacteria then, the typhoid, will inflame the appendix, the lymph nodes found at the Peyer's patches. It will compromise the blood supply, the venous drainage. So in that particular area, that's why you have ileitis, inflammation of the ileum. So, ano yung uploading? Alright. Okay, so, question. So tomorrow, organs, then dissect further the organs function, what part of the organ functions, no? So this is the organ. You still have cells, no? Complement cells. You still have the other exterior, the mouth, no? So the mouth is found inside either what? Mucosa, no? Mucosa na siya depends. So it depends. It's found in digestive, in the bronchopleural mucosa. May mga, you can divide mouth also into sound. Okay? So that's part of the inferior defense also. So the tonsils is found here in the mucosa. Okay? So in childhood, dako na siya, but later on, puberty, it will atrophy also. Okay? Pero sometimes na ma-inflame na siya, mga tonsillitis, na binagdanan siya na siya mga, naman na siya mga buhok-buhok. And sometimes it become inflamed and inflames, no? Yeah. So, inflamed na siya, so it becomes also inflamed. Tonsils. Now that the tonsillar pillars behind the, more or less, oral cavity. Right? So, okay? No more? Tomorrow, discuss or another case.